In the recent past, I have received many comments in my video requesting me to talk about trismus. So basically, trismus is reduced mouth opening, and it can be secondary to trauma, temporomandibular disorders, space infection, malignancies, dental extractions. And here in this case, I'm specifically going to talk about trismus secondary to dental extractions. Now, trismus secondary to dental extractions, it can be because of either local anesthesia or actual extraction technique. Now, in both the cases, there are two subcategories. Trismus can be secondary to infection, or it can be secondary to mechanical trauma. So, trismus secondary to infection, in that if we use a contaminated needle, contaminated syringe, that can lead to infection in the pterygomandibular space. And because medially in the pterygomandibular space, we have the medial pterygoid muscle, and the medial pterygoid muscle can go into spasm, and that can lead to trismus in local anesthesia infection. Whereas in infection in dental extraction, either the tooth was already infected, or because of improper technique, because of improper sterilization, there is infection after the extraction. So this infection can spread to the adjacent spaces, that is submandibular and sublingual space, and through those spaces this infection can spread posteriorly to the pterygomandibular space. And now again the same thing, the pterygomandibular space, medially we have the medial pterygoid muscle, and this medial pterygoid muscle, it can go into spasm leading to trismus. Now in mechanical trauma, under local anesthesia, if we are giving local anesthesia again and again, there are multiple punctures. So this can lead to multiple needle prick injuries to the medial pterygoid muscle. This medial pterygoid muscle can then go into spasm leading to trismus. That is one. Second, while giving inferior alveolar nerve block, if by mistake if we have deposited the local anesthesia solution very close to the muscle or inside the muscle, now this local anesthesia solution, lignocaine, is myotoxic in nature. So this is going to irritate the muscle and it can cause spasm in the muscle. So this spasm can lead to trismus. So this is mechanical trauma because of while giving local anesthesia. In extraction, in dental extraction, especially in cases of mandible, in case of close extraction, in cases where we apply elevators to elevate a tooth out or a root out, we are applying a lot of pressure using the elevator on the mandible. Now, if we don't support the mandible on the inferior border, the force that is being transmitted on the mandible using the instrument is transmitted to the TMJ and all the muscles of mastication. These muscles of mastication that are relevant here are temporalis, masseter muscle, and medial pterygoid muscle. So when we apply the elevator and we don't counter that force by the at the inferior border of the mandible, then we are causing excessive stretching of these muscles, and these muscles, because of this excessive stretching, can go into spasm. So this spasm can lead to then trismus. Second is if we are doing an open extraction, transalveolar extraction, especially in cases of mandibular third molars. In those, we give a releasing incision, that is anteriorly and distally we give releasing incision. So if we are not very careful while placing the distal releasing incision in the third molar surgery, we might damage the fibers of the temporalis muscle. So that can lead to spasm of the temporalis muscle leading to trismus. Now, how do we differentiate between trismus secondary to trauma or trismus secondary to infection? Now, trismus secondary to mechanical trauma, it will be seen immediately after the procedure. Within 1 to 2 hours, you will be able to see trismus in the patient. Whereas trismus secondary to infection, this trismus will be visible in the patient after 2 to 3 days of the procedure. So what is the management? Be it trismus because of the mechanical trauma in LA or exodontia, or be it trismus secondary to infection, again in LA or exodontia. In cases of trismus secondary to mechanical trauma, you just have to give some analgesic along with muscle relaxant and some warm saline gargles, and that is going to treat the trismus in this condition. If the trismus is secondary to infection, the root cause of the trismus here is infection. So we'll have to manage the infection. So for that, we're going to administer some antibiotics. Most commonly used antibiotic is amoxicillin clavulanic acid along with metronidazole. Along with that, you can give muscle relaxant along with mouth opening exercises. Ice cream stick exercise can be given, or you can give Hister's mouth gag for exercising to the patient. So this is how you manage, how you differentiate between the two causes of the trismus, that is trauma or infection. Thank you.